Here, I would like to explain about USMLE high yield question in neurology. Here, I will explain the way that I learn. I give credit to Bots and Beyond's Dr. Ryan who explained, and this is very useful for me to solve the neurology question in USMLE. Here, it will start with this one, okay? Firstly, you have to remember rule of force. First, you have to know the cranial nerve that exit the brain from the brainstem and in their position, okay? So there are 4 cranial nerves that are above the pons, yeah, above. It is cranial nerve 1, 2, 3, and 4 that you remember this one first. After that, another 4 cranial nerves that exit at the pons. That is cranial nerve 5, 6, 7, and 8. And another 4 cranial nerve that exit at below the pons, that is the medulla part. That is 9, 10, 11, and 12. That is 3 places that you have to know, okay? 4 above the pons, 4 at the pons, and 4 below the pons. And also the position that they exit, that they are, we divided into 2 categories. That there are some cranial nerve that exit at the midline and some cranial nerve that exit at the lateral, okay? So we have to remember again that there is 4 cranial nerve nuclei that exit in the middle, okay? That they are 3, 4, 6, and 12. That's how I remember is these cranial nerve are equally divided by 12. If this cranial nerve, if this cranial nerve number can be divided by 12, so they are exit at the middle. That's how I remember, okay? 3, 4, 6, and 12 exit at the middle. They are this number can be divided by, can equally divided by 12, so they exit at the middle. And also the middle cranial nerve that exit from midline, they are motor nuclei, okay? Everything that exit in the middle are motor. And also 4 cranial nerve that exit at the lateral. So lateral is 5, 7, 9, and 11, okay? That they cannot be divided by 12. That number are very odd number, so they cannot divided by 12. So when you see, you know they exit from lateral part of the brain. And if they exit from lateral, they are sensory nuclei. So that is the rule, okay, that we have to remember. And also the midline position cranial, midline position, what do we have in midline? That also we have to remember. There is 4 function that exit in the midline column, that are motor nucleus exit in the midline, motor pathway also exit from midline, MLF medial longitudinal fasciculus also in the midline, and medial lemnicus that also in the midline. And that is I will explain, okay, when I'm going to solve the problem in the next video or next slide, that I will explain what does that mean, okay? And also now start to try to remember there are also 4 function that exit from the side or lateral, okay? Side or lateral is all start with S, such as sympathetic function from lateral, spinothalamic from lateral, sensory also from lateral, and spinocerebellar function also from lateral. That's a detail we will explain in the next slide, okay? And also now we will expand these points one by one in next slide. And now I will start to explain what is the 4 cranial nerve that exit above the pons, okay? That firstly 1, 2, 3, 4 I said. So 1 and 2 mostly they are not from the midbrain, so we do not have to consider them in our USMLE question. Mostly olfactory, they exit from their basal skull to the front part of the brain, to the frontal part, so that olfactory is different. Optic also different. But what we have to consider in the USMLE question that is we important is 3 and 4 cranial nerve that exit in the midline above the pons, okay? So when there is a lesion in the cranial nerve 3, that is oculomotor cranial nerve, we will see the lesion as the eye is turned out and down. When we see the patient eyes out and down, that we have to know that is the lesion from the cranial nerve 3 that is above the pons and in the midline. And also, if we see the question that the patient say the eye is unable to look down when looking the nose. Okay, when we ask the patient to look the nose, he cannot see his own nose. Cranial nerve 4 is damaged. Okay, so cranial nerve 4 question, it was show like this, or sometimes they show the patient cannot see properly their face when they try to climb the stairs. That also the one of the question stem that they show, that is the damage to the cranial nerve 4. Here I will explain more about 4 more cranial nerves that exist at the pons. Okay, that is cranial nerve 5, 6, 7, and 8. That they exist at the pons. So how do we say these cranial nerve lesion in the question stem? That is, firstly, if we say cranial nerve 5 lesion, they will say there is a ipsilateral phase sensory loss. Cranial nerve 5 is a tricky one. Okay, if you see it, that's the only sensory nerve only. So when there is a sensory part of the face that has a problem, that is cranial nerve 5, not 7. Okay, that we have to remember. And also cranial nerve 6 abduction. So the patient cannot do the abduction of the eyes ipsilaterally. That's cranial nerve 6 lesion. Cranial nerve 7 lesion, it means that there is a motor weakness. 7 facial nerve is a motor neuron. So when there's a ipsilateral facial weakness or ipsilateral face drop, so it means that there is a cranial nerve 7 lesion in the patient. And also, what do they say about cranial nerve 8 or D3? Auditory lesion, so there is a ipsilateral deafness. That is also a tricky point you have to remember. In pons, cranial nerve 8 is, we can only say cranial nerve 8 is damaged when there is a deafness. When there is a vertigo or nystagmus or vomiting such as vestibular symptom, we do not assume that there is a cranial nerve 8 involvement. We will assume there is a vestibular nuclei in somewhere in the brainstem is the problem, but when there is an involvement of deafness only, we will assume cranial nerve 8 is involved. Okay, that we have to remember. So we will go to 4 more cranial nerve that exist at the medulla. Okay, that is 9, 10, 11, and 12. So cranial nerve 9, it is a glossopharyngeal. So what do we see in question stem is there is a pharyngeal sensation loss in the ipsilaterally in the throat. So that is cranial nerve 9. Cranial nerve 10 is vagus. Vagus is more about swallowing, speaking, and coughing. So when there is a weakness in palatal weakness, cannot swallow, so it is a cranial nerve 10 involvement. When there is a spinal accessory 11 involvement, it will show as a shoulder, ipsilateral shoulder weakness. And also if there is a cranial nerve 12 involvement hypoglossal, so patient will show with ipsilateral weakness of the tongue. So tongue is deviate to the side of the lesion. Okay, so ipsilateral tongue weakness, so it will be hypoglossal nerve 12 involvement. So we already know we divided into 3 sections. Okay, 4 above the pons, 4 at the pons, and 4 below the pons. So now we already know that these cranial nerve, each one, and how do they present in the question stem. So next slide, I will explain more about what does it mean to be midline structure M. Okay, so if there is a motor pathway corticospinal involvement, so it means there is a weakness contralaterally. Okay, if there is a body involvement, it always have to be contralateral. So contralateral weakness of the body, so it means motor involvement. We will have to assume the corticospinal is involved. When we see there is a loss of contralateral proprioception vibration involvement, we have to know it is a medial lemnicus, dorsal column. Dorsal column involvement with the contralateral side, proprioception and vibration loss. So we will assume there is a medial lemnicus. So it is a midline structure again. Another, if there is a ipsilateral INO, then we will know medial longitudinal fasciculus, MLF. MLF involvement is always have to be ipsilateral INO. Okay. And also, if there is a motor nucleus involvement, so we will have to recall what are the motor nucleus. Motor nucleus are the nucleus that exist in the midline, right? So exist in the midline is the number that can be equally divided by 12. So it is a 3, 4, 6, and 12. If there is a 3, 4, 6, and 12 lesion, we will assume this is a midline structure. So now we know if there is an involvement of 3, 6, 3, 4, 6, and 12, there will be midline. If there is an involvement of INO, it is a midline. If there is an involvement of proprioception and vibration, medial lemnica structure, so this is a midline. If there is a motor weakness, it is also midline. Okay. So how do we know there is a side part? Okay, side part or lateral structure as involvement. As involvement, everything start with as. Okay, spinocerebellar, so it will be ipsilateral ataxia. If there is a spinothalamic involvement, there will be contralateral pain and temperature sensory loss. Okay. If there is a sensory nucleus are lateral structure, right? Lateral structure, so it is not everything except 3, 4, 6, and 12. Cranial nerve, sensory nucleus, cranial nerve. There is a mostly sensory nucleus, one we say in this line. It is a ipsilateral pain, and mostly we assume all about cranial nerve 5. So when there is a pain and sensory loss in the face, ipsilaterally, that is a cranial nerve 5 involvement. If that is a cranial nerve 5 involvement, we are assuming it is a lateral structure. Okay. Another thing is that sympathetic pathway involvement. If this is a sympathetic pathway involvement, there will be ipsilateral ulnar syndrome. Okay, there is a ipsilateral ulnar syndrome, then we will know it is a sympathetic pathway, so we will assume there is a side structure that is the problem. And also, this is the star point that I am showing here, that is a cranial nerve 8 involvement. Only assume when there is a deafness. We do not assume cranial nerve 8 when there is only vestibular symptom like vertigo or nystagmus. If that is not cranial nerve 8. Cranial nerve 8 is only when there is a hearing loss ipsilaterally. Okay, here is the way how USMLE question present and how do we correctly choose the correct answer, right? So we have to choose. We have to choose firstly whether this is from pons or midbrain or medulla, and also whether this is a medial medulla or lateral medulla, medial pons or lateral pons, right? So here I will give you a trick that I use mostly from the Bots and Beyond Dr. Ryan teachings. Okay, I give full credit to that man for teaching us. Thank you very much, Dr. Ryan. Here I will tell you how do we solve the question stem. Okay, firstly I will review again the midline structure cranial nerve that are 3, 4, 6, and 12. Medial part, and also a lateral part, that is a 5, 8, 9, 10, 11, that is lateral. And also cranial nerve 3 and 4 in the midbrain, cranial nerve 5, 6, and 8 in the pons, cranial nerve 12, 9, 11, and 12, 9, 10, 11 in the medulla. So if we find out there is a I will expand everything more when we go to the question stem to explain you better. Now here I will try to explain what I write in this paper. Okay, here we will know there is a midbrain is all supplied by PCA, posterior cerebellar artery, medial or lateral, or together by midbrain only. And the pon is divided into 2 parts. Lateral part is given by AICA, okay, anterior inferior cerebellar artery. Medial is given by basilar artery for the pons. Lateral AICA, medial basilar. For medulla, it's a lateral is pica, okay, posterior inferior cerebellar artery. Medial is ASA. So when we can locate the lesion, whether this is a midline, whether this is a medial, so it is a medial medulla artery. So what is the artery that supply? That is a anterior spinal artery. That's how we will locate. Okay. So now, inshallah, in the next video, I will try to solve the USMLE question stem by using the facts that I give in this video.